Now, not perhaps what we wanted to hear, but there are more signs tonight that COVID is making a major comeback across the UK. According to the latest survey figures, infections jumped by more than 500,000 in just a week. That's a rise of a third. The surge in COVID cases is already being felt in workplaces, schools and colleges across the country. It's rising in all ages. The number needing hospital treatment is now also going up, with more than over 65s now being admitted to intensive care. People who've already had the virus are among those being infected with the latest Omicron variants, the likely culprits.
Familiar fears have been ignited as cases soar across the country. This restaurant preparing for its busiest night, cutting back though on staff with 7 off sick. News that managers are well versed in dealing with, pulling out the protocols they hoped to never use again.
We've had to pinch from other branches to be able to fill the gaps. And that's not easy because while you're taking away staff from one branch, then you're leaving those branches short.
And how much of a financial impact is that having on your business?
Tremendous. I mean, the financial impact is the major. I would say that we are about 30% down, generally, all across the board.
And is that in the tens of thousands for your business?
Yes, yes.
Yeah.
Last week, the number of people with COVID rose to 2.3 million, which is an increase of 32% on the previous week. And the same as around 1 in 30 testing positive. It's the highest number of infections since April. So far, though, patients needing intensive care remains low. But that is rising, and so is the number of hospitalisations, not yet at the rate before the vaccine rollout, but a rate that is beginning to worry some.
The concerns are that if this is a picture in the middle of summer, what may we get in autumn? What we need to do is immunise and suppress cases locally. Otherwise, we keep on seeing variants which can then marginally bypass the antibodies.
One of the reasons why, since March, NHS England has invited those 75 years old and over for their spring booster, extended to those 65 years old and over in September with the autumn rollout. Protection, health experts warn, is vital as infections rise, largely driven by new Omicron variants.
It doesn't seem that they are more deadly than the original version of Omicron, and that was less serious than the Delta variant. The likelihood of being admitted to hospital was lower. But to put it into perspective, we're now at about 8,600 people admitted in the last week with COVID.
Putting pressure not just on their health system, but hospitality too, as the rise in infection rates means a reduction in staff and companies having to adapt to keep business moving. Sangeeta Lal, News at 10, Bradford.